Hi everyone, this is a quick lecture on mastering Plab 1 question. It's very important for any doctor preparing for Plab 1 exam to understand what the question is asking you. And this is a main reason why a lot of people who do prepare well for the exam, but they fail or they lose marks in a lot of the question just because they don't understand what the question is asking them. So the first one we need to understand is the initial. When the question asks you things like what is the most appropriate initial investigation, what is the most appropriate initial management, what is the most appropriate next step, these ones don't have any tricks to it. They're just what it is asking you. For example, they ask you a patient who comes with signs and symptoms of anemia. Okay, what is the initial investigation that you would do? It's going to be your FBC, hemoglobin, right? That's the first thing you will do to check the amount of the level of hemoglobin. Okay, there is a non-medical question I have asked here. You can pause the video and have a read of that as well. Most appropriate, this is very important. So what does that mean? This basically means the best management or investigation at this stage. It does not mean, it doesn't necessarily mean this is the first thing you would do or the best thing you would do, but really it was asking you what is the best thing you would do at this stage. Okay, so example here, I said to you that Romeo misses Juliet. Juliet moves to New York recently and Romeo wants to speak to her. So what does he do? We have three options. Number one, he's got a phone. So does he buy phone credit to call her? Number two, does he call her by the phone? Number three, does he fly over there physically and speak to her there? So we know that the best thing, the most definitive is going to be to speak to her by traveling there. But the most appropriate at this stage is going to be call her by the phone. But you don't have to say the first one here, because if they were asking you the initial thing, that would be that. They're asking you the most appropriate in this stage. Once we do some more medical question, you'll understand this a bit more. Definitive is very important. And what that means is that basically what is the best thing you would do? What is the thing that's going to be 100%? Okay? It doesn't mean that you would do it at this stage. The patient needs it at this stage. It's just asking you, regardless whether it's appropriate or not appropriate at this stage, what is the thing you would do 100% to confirm the diagnosis? So in here, very common question in the exam. Mr. Brown, he works in a shipyard industry and he's been exposed to asbestos. Obviously, we know that this has risk of causing mesothelioma. Okay, well, so what is the most definitive investigation? So bear in mind, in here, we just suspect the patient has this condition based on history. We have not done any investigation. So therefore, the most appropriate is going to be CT chest to see whether he's got any thickening of the pleural membrane. Okay, but the definitive is going to be biopsy, which will tell us on a histological picture whether he has mesothelioma or not. So in here, they're asking you definitive investigation is going to be pleural biopsy. However, it doesn't mean that at this stage you will do this first. You need to do a few other things, such as CT chest before doing the biopsy. So when it says definitive, it does not mean that you will do at this stage. Few questions for you to understand, okay? So a few things we said. Initial, most appropriate, and definitive. So this is a chap here, he's 40 years old, he feels tired, he's got symptoms of anemia, his vitals are normal, he's got weight loss, okay? What is the most initial investigation? So he's 40-year-old, which we're thinking he's got some sort of cancer, but he's also got signs and symptoms of anemia. So the first thing we would do is that we need to check his FBC. Okay, we will not go for any sort of investigation like scoping and biopsy at the moment or CT abdomen. These may be required, but however, because the patient is coming with signs and symptoms of anemia as well, so the first thing you would do is check the FBC. Maybe he might need some sort of transfusion or some other management for these anemia symptoms. Okay, same patient here. Exactly the same thing, okay? So what is the most appropriate investigation? Now, can you see the differences here? It's not asking you what is the first thing you would do, but what is the best thing you would do at this stage, okay? Not like at this moment, but at the current stage he's at, it's going to be scope, colonoscopy, and biopsy. In here, the answer in here most appropriate. Now, if they ask you the definitive, the answer is going to be the same as well, because colonoscopy and biopsy, this also gives you the 100% whether it's cancer or not. So sometimes the most appropriate is going to be the most appropriate investigation. However, that most appropriate is also 100% as well sometimes, like in this case. Okay. Number 3, a 40-year-old man has been tired, and feels and reports for having blood in his stool. Patient looks well and everything. What is the definitive investigation? Same chap here. They're not asking you the initial. They're asking you the definitive to see whether he's got cancer or not. It's going to be biopsy, colonoscopy and biopsy. However, this is also the most appropriate. Number 4, this woman here, she's got GCA, with GCA, the first thing you would do is going to be ESR. And after having the ESR, if it's raised, you start them on steroid, and then you need to arrange a biopsy, temporal artery biopsy. So the initial investigation is going to be ESR. When they ask you, the most appropriate is going to be, again, ESR, because this is the best thing you do at this stage, It won't be temporal artery biopsy, because this is not the thing that you would do to start management. If they ask you, definitive investigation is going to be artery biopsy. So in here, as you can see, we have 3 different things. So when they ask you what is the first thing you would do, is going to be ESR. Most appropriate ESR. So in here, initial and most appropriate are actually same, because the most appropriate or the best thing at this stage is to do ESR, which is actually also the first thing you would do as well. But the definitive to give you whether the patient has a temporal artery temporal arteritis is going to be biopsy. Hence, it's going to be the most definitive. Now, if they asked you in the exam question, the patient already had a already had blood test, ESR is high, the patient has been started on steroid, what is the next step you would do? Answer is going to be C, temporal artery biopsy. What is the most appropriate thing you would do? It's going to be C, temporal artery biopsy. It all depends on how the question is and the wording of the question, how the patient history is and the wording of the question. Okay.